Lung cancer is one of the most prevalent diseases we currently have today. In this presentation, we will be discussing the different types of lung cancer, the symptoms and causes of lung cancer, the treatment options, the history of lung cancer, as well as the incidence and mortality rates. I hope you all enjoy. According to lungcancer.org, lung cancer is when uncontrollable cell growth occurs in one or both lungs. These cells can cause tumors and do not serve any function as normal cells do. These tumors can cause blockage and inhibit the proper functions of the lungs. They can also affect the distribution of oxygen to the rest of the body. Non-small cell lung cancer equates to approximately 85% of all lung cancers and includes adenocarcinoma, which is the most common form of lung cancer. Small cell lung cancer grows faster than NSCLC, but it responds better to chemotherapy. There are 4 stages of non-small cell lung cancer. In stage 1, cancer cells are only found in the lungs. In stage 2, the cells are still in the lungs but are near the lymph nodes. In stage 3, the cancer cells are found in the lungs as well as the lymph nodes. In stage 4, cancer is in both lungs as well as the fluid and possibly other parts of the body. There are 2 stages of small cell lung cancer: the limited stage and the extensive stage. In the limited stage, cancer cells are only found on one side of the chest. In the extensive stage, the cancer has spread to other parts of the chest and lymph nodes as well as different parts of the body. Lung cancer was identified as a disease in 1761. By 1810, there were several characteristics of lung cancer that were identified. In 1940, it became the second highest cause of cancer death. Lung cancer accounted for about 27% of all cancer deaths in 2013. There was no single person that discovered the disease, but in 1929, a German physician named Fritz Lichten established a connection between smoking and lung cancer. Because of this connection, there was an anti-tobacco movement created in Nazi Germany. In order to diagnose lung cancer, doctors must take a sample of lung tissue to examine. This procedure is also known as a biopsy, and it is the best way to diagnose lung cancer. Screenings such as a CT or PET scan can also help reveal any suspicious activity of cell growth. Notice the bright yellow color on one of the lungs. That represents a tumor caused by uncontrolled cell growth. As you can see, the other lung is free from any abnormal cell growth. This picture gives you a better visual understanding of how a tumor can inhibit the lung's normal functions. Lung cancer is one of the most common forms of cancer, affecting 2.1 million people worldwide. About 541,000 Americans have been diagnosed with lung cancer. Lung cancer mostly occurs with elderly people. Approximately 86% of those diagnosed with the disease were people over 60. About 87% of lung cancer is related to smoking. Secondhand smoking also increases the risk of developing lung cancer by 20 to 30%. Other factors such as air pollution, radiation, genetics, and tuberculosis can also contribute to the development of lung cancer. Symptoms can occur in the chest as well as other parts of the body. Lungcancer.org lists some of the symptoms as coughing, especially if it is persistent or accompanied with blood, pain in the chest, shoulders, or back, weight loss or lack of appetite, swelling of the face or neck, or general weakness, among many others. Because of the popularity of smoking in the earlier decades, many people have struggled to quit, while others have developed lung diseases, including lung cancer, due to their bad habits. As a response, several anti-smoking campaigns were created to raise awareness and encourage people to avoid smoking. Lung cancer is the leading cause of cancer death, surpassing breast cancer in 1987. An estimation of 154,050 Americans diagnosed with lung cancer were expected to die in 2018. In 2005, the number of deaths due to lung cancer peaked, resulting with a total of 159,292 deaths. Most people diagnosed with lung cancer have to receive many chemotherapy sessions, although they have the freedom to opt out of them. Making sure that you remain physically active can help after treatment. Medication can also be taken to help reduce pain from the treatment, as chemotherapy can be very hard on the body. The treatments involved are chemotherapy and radiation. Surgery can also be performed, but only at the earlier stages of lung cancer. Chemotherapy is often given regardless of how advanced the cancer is. It can also be given after surgery to help prevent cancer from returning. Chemotherapy is an effective treatment because it damages cancerous cells, but it can also damage other parts of the body as well. Some side effects from chemotherapy include hair loss, nausea or vomiting, weight loss or weight gain, pain, fatigue, and mouth sores, among many others. The CDC recommends that in order to decrease the risk of lung cancer, one must avoid smoking because it causes about 80 to 90% of cases of lung cancer. They also recommend to avoid secondhand smoke, get your home tested for randon, and follow the health and safety guidelines at work to avoid carcinogens. More than half the people diagnosed with lung cancer die within a year. Only 18.6% of people with lung cancer live 5 years or more once diagnosed. Only 16% of lung cancer is detected at earlier stages. Therefore, the chances of living 5 years or more with lung cancer decreases to less than 5%. And that concludes the end of the presentation. I hope this information has helped shed some light on this topic. If you or a loved one is suspecting lung cancer or have any other symptoms mentioned, please visit your local physician and have it checked out. Thanks.